Welcome to Evergreen Family Medicine. Today we are with Dr. Tim Powell, the CEO of Evergreen Family Medicine, and Ashley Miller, the Quality Coordinator here at Evergreen. And today, a discussion around PCPCH, which is a term you may hear from time to time here at Evergreen. But today, we're going to get an in-depth look into what exactly that means. Dr. Tim?
So Brian, in medicine we do love our acronyms, and we have a ton of them. PCPCH is one of those. I will tell you that the titles or the acronyms of programs don't always indicate their value. The patient-centered part is the only part that the audience really needs to kind of key in on. And I want them to know that this particular function is very, very important to us. I want to show the audience a little bit about how this fits into our mission. The patient comes in and they have the experience that they do. They hopefully enjoy their time with the providers, a very personal and important time. But that's a very small window of what Evergreen is about, very important window, but surrounding that is an infrastructure that really protects that time and oftentimes facilitates it. And so I want to show you a little bit about our organizational structure. Now, a healthy organization is very intentional in the way that it organizes itself, not just with who reports to one another, but how different committees communicate with each other and how they facilitate each other. What you see here is our entire organizational structure, and I want you to look at the very center square there, which talks about the Evergreen Board. That Evergreen Board of Directors is entirely made up of physicians who also work here. Ultimately, they are responsible for everything that happens, and they take that responsibility very seriously, but there's no way they can do it on their own. Now I'm going to draw your attention to the two smaller blocks down below. On the right side there, you see our Quality Improvement Committee. The whole term, again, acronyms we love, QAPI, Quality Assurance Performance Improvement. And we have a lot of subcommittees then to report in to that committee. And this committee really has to do with making sure that the care we deliver is top-notch. We're continually looking for holes. We're continually measuring ourselves in terms of performance indicators and metrics, and we're continually reviewing cases or even sometimes social determinants of health that impair access or affect outcomes. And so that's all has to do with quality. Now I'm going to move over to the second quadrant, which on the left. This is where you find that famous PCPCH, and you see a ton of subcommittees around there. And I will tell you that PCPCH entirely has to do with the patient experience and access. And we are continually looking at every aspect of those two things, access and the patient experience, to understand what we're missing, what we could do better to improve in those two areas. So what you see on the screen now is a blow-up just of PCPCH and the subcommittees that report to it. And each of these subcommittees have a host of responsibilities of their own. Our ancillary committee has all of the things that fall outside of usual face-to-face things we do in the office. There are nursing home visits, our behavioral health, so many things that we do there. You'll see just to the right of that, school-based health care, an important thing that we do, diabetic education and support, our patient advisory committee, all of our Athena super users, the people that advise us on how to get more out of our electronic health record. And the reason that's important is the portal of our electronic health record is an incredibly important way to allow patients access and to give them immediate feedback to questions that they have. We have a chronic pain management committee, we have a dementia support group, a well child where we just do walk-in well child visits for people that aren't able to keep appointments, one that looks at all of our protocols. And there's a lot of other subcommittees not listed there that all feed into this very, very important committee, PCPCH. And fortunately here today we have somebody really important to us at Evergreen Family Medicine who is Ashley Miller. And Ashley is our quality coordinator, and she also heads up our PCPCH, or patient-centered home program. She has been here, Brian, really since the start and has seen this through and probably understands it at a level greater than just about anybody else here at Evergreen.
So Ashley, tell us about how this concept how did it start at Evergreen and where has it grown into? How important has it become here?
Back in 2013, Evergreen first became a patient-centered primary care home, and that is a program with the state of Oregon that's designed to better take care of our patients, provide high-quality care, lower costs, increase both patient and staff satisfaction. So when we first became a PCPCH in 2013, it was new. We were really just kind of working through the standards, figuring out what we needed to meet, and really, to some extent, we were checking boxes, kind of making it work to get this designation. And so in the 10 years now that we have been doing this, I think we've seen our team internally kind of transform in the way that we think about taking care of our patients. So Dr. Tim has always been very innovative, and so kind of using his drive and intent for the company alongside the goals of the PCPCH program, we start thinking outside of the box, thinking of ways that we can better serve our patients where they're at outside of the exam room, offer additional services. And so then on the back end, we kind of say, okay, how does that fit into our next attestation for the PCPCH program?
I think I've seen Ashley grow as I've seen our committee grow, as well as our concept of PCH grow during this time. Ashley talked about checking the boxes, and everybody's been there. You're just trying to get qualified or certified for whatever it is, as opposed to really making it your own. And what Ashley has added and what the committee has grown to, where it's become very personal now. It's not something we do, it's how we do everything, is through the PCH process. And as we look at every one of the standards, as Ashley was talking about the state, we'll pick at some of them and say that makes no sense whatsoever. And we'll look at the some other ones and say, that's a great idea. This is how that can be expressed here. And a lot of times as we've spoken then with folks at the state, they will say, gosh, we never thought about it used that way, but we love the idea. And so it really is a framework for our creativity to kind of be harnessed. And Ashley really has a hard job taking all these great ideas and fitting them within the structure and making the committees really talk to one another.
What else do you want to talk about when it comes to PCPCH at Evergreen?
I just really love some of the ideas that have come out from that committee. It's a really good mixture of people from all locations across all the different departments. So we have that collective, thinking through all of the processes. So a couple things that I'm really proud of that came out of that committee over the years. One is our dementia support group. We know that dementia is a really challenging disease, that the family needs a little help sometimes dealing with that. And so creating that group allows them to come together with people who are going through the same thing. And not only can they usually come away with some tips or helpful information, but it's also just that kind of camaraderie that they can build with the other members attending that support group. So that's one thing that I'm very proud of that we started. Another service that we've been able to roll out over the last couple of years is our CHWs. They're our community health workers, and they're just amazing. They can do kind of whatever is needed for the patient. So, the patient's being seen for their office visit, and we're getting, close to time, and the patient says, you know what, actually I'm really struggling with getting food on the table or getting rides to my doctor's appointments. Something that maybe you don't really think of in a medical appointment that should be talked about. And so the CHWs can come over and meet with that patient. They can do kind of an assessment and figure out what what all kinds of services the patient needs and might be eligible for. So we've seen, you know, things like taking a food box or getting a ramp built for a patient's home through Habitat for Humanity. Just the possibilities are kind of endless. So that's something that's, I think, is really special that we have at Evergreen.
Well, all of those things are amazing, and we've shot videos and interviewed some of the people involved in many of the things that you just talked about, which means that people can find that information at Evergreen Family Medicine or on the social media channels associated with Evergreen. Dr. Tim, you want to close this out?
You know, the only thing I would add is Ashley talking about making it ours, an idea sort of, and I think even as the state ruled out community health workers, they had no idea how helpful they could be in so many different ways. As we sit in the PCPCH, and the reason we have people from receptionists, from every level, is everybody sees patients' needs maybe through a different window and sees it differently and recognize this person is struggling in this way. And so we had a lot of folks that just could not keep a schedule. Their life was hectic and they could not. So we had walk-in child visits. When COVID was rampant, and we understood that our nursing home patients, if they came to see us, had to go back into isolation for 10 days. We sent nurses out there with our telehealth to take care of that. We understood how much unresolved grief there was in the community. So we set up grief counseling classes. All these things came through PCPCH, but it came having open minds and open hearts, listening to what the patients were saying, and then coming together and saying, can we find a solution to this? And then the engine that would wrap all this around is our PCPCH process.
Terrific. Well, I know it's so important to you that we've spent this much time to explain to the patients at Evergreen what PCPCH is, why it's here, and all the benefits from it. So thank you for the time.
Thank you.
You can find out more about what's happening at Evergreen Family Medicine at evergreenfamilymedicine.com or online. Follow our social media channels on YouTube, Instagram, Facebook, and Twitter.